name's Lon Ben-Asher, registered dietitian nutritionist with Pritikin Longevity Center. What we do here is we teach a lot of the classes to try to help people eat a little bit healthier. I consult with people to customize a plan so they can be successful once they leave here from the program. We also remotely coach with people so they can stay successful once they get back into the real world. Some of the major reasons people come to see us is that they're trying to lose a little bit of weight. We also get a lot of people that are trying to improve different elements of their health, like their cholesterol, their blood pressure, their blood sugars, as well as other aspects of their health. A lot of the studies have supported and shown convincingly that losing weight helps improve a lot of elements of health. It reduces the risk of diabetes, cardiovascular disease. It helps improve the gut microbiome. It really helps support a healthy immune system as well. One of the most popular trends that are going on today are these new GLP-1 medications that are on the market. And a lot of people are taking them to try to help them lose weight. They suppress your appetite so that you're not eating nearly as much food, which translates to you eating less calories. If you get to a calorie deficit, that's going to help promote weight loss. The other thing that it's been shown is that it's actually helping to reduce people's cravings. They have seen reduction in people's cravings with sugar. They've also found that it helps reduce cravings for alcohol consumption as well. We know that there are some pros of a lot of these GLP medications in helping people lose weight. But just like a lot of pros that exist with different types of medications, there's also some cons that they have shown as well. There are certain side effects that people can experience when they consume these GLP medications. In fact, a lot of the literature review have shown that about 40 to 70% of people who take these GLP-1 medications have some level of gastrointestinal adverse effects. And some of those effects are centered around nausea, vomiting, diarrhea, and abdominal pain. Based on an expert panel of physicians, they had provided clinical recommendations that were published in the Journal of Clinical Medicine to help patients that are taking GLP medications manage some of the side effects associated with those drugs. And those recommendations are in complete alignment with the Pritikin Program and is a great solution for people that are taking these medications that want to mitigate some of those side effects associated with those drugs. Some of the recommendations had to do dietarily wise. They were recommending that people consume low-fat diets. The Pritikin eating plan is a low-fat dietary approach. In addition to that, the expert panel was encouraging people to consume a dietary plan that is high in water. The Pritikin eating plan incorporates and encourages people to eat foods that intrinsically contain high volumes of water because water helps fill you up. It builds a lot of volume into your stomach, so you eat less food because of it, which helps you lose weight. In addition to that, the expert panel was recommending people to consume dietary fiber-rich foods, which completely aligns with the Pritikin eating plan because we're encouraging people to eat a lot of fiber-rich foods. You're consuming a lot of vegetables, a lot of fruits, unrefined carbohydrates, and certain foods that are going to promote someone's ability to lose weight, but also mitigate some of those gastrointestinal effects that people might suffer from. One of the things that the expert panel also introduced was recommending people to take more of a mindful eating approach to really try to help them slow down the eating process. And that is in complete alignment with what we teach here at the Pritikin Program. In fact, we do an amazing luncheon experience for our guests who come to our program where we teach this intuitive, mindful eating approach. We provide practical tips and strategies to really help people slow down the eating process. We encourage people to look at food as a nourishing experience, focus on the food that they're consuming, as opposed to just trying to get the food down as quickly as they possibly can. So we have been shown to be in complete alignment and a great solution for people that are taking some of these weight loss medications and helping them get through some of these gastrointestinal effects that they may suffer from. In addition, many medical professionals are very much concerned about the amount of muscle loss that's associated with GLP-1 medication use. In 18 randomized clinically controlled trials in the journal Current Diabetes Reviews, during GLP-1 medication use, muscle loss and lean body tissue makes up about 20 to 50% 50% of weight loss. So we know that when people start losing a lot of muscle mass and lean body tissue, there are a lot of ill health effects that can occur. We know that it can certainly affect the cardiovascular system. We know that it can certainly impact bone health. People can have increased risk of falls and fractures. We also understand that when people start losing muscle, their basal metabolic rate starts to decline, which can make it even more difficult for people to lose weight because they're not able to burn calories as efficiently and effectively as well. This can be attenuated by increased protein intake and making sure that people are taking part in an exercise regimen that includes resistance exercises. Here at the Pritikin Program, we provide a personalized approach to ensure that everybody is getting enough protein intake to meet their body's needs. Lean protein sources from things like fish, white meat, skinless chicken, plant-based protein sources such as beans, lentils, legumes, tofu. All of that aligns with the recommendations of a lot of different evidence-based literature. And we also have a very, very structured exercise regimen where we provide a lot of support for people to start getting active cardiovascularly, but also we have exercise physiologists that teach our guests how to start exercising by building more muscle tissue to help ensure that you're mitigating any of the potential muscle loss associated with these GLP-1 medications. If you are either thinking about taking these medications or you're currently taking some of these medications, we invite you to come to the Pritikin Program. There's a lot of things that you're going to learn here as foundational principles to help your health. It's a medically supervised program. So you have the opportunity to meet with physicians, behavioral health experts, exercise physiologists, registered dietitians. It's a multidisciplinary approach to help you with whatever health goals and needs that you might have. We're in beautiful, sunny South Florida. You have the opportunity to enjoy a lot of the amenities that exist here at the resort. Come down to the Pritikin Program. You will not regret it. It will change your health forever.